You think earwax is the grossest thing that can come out of your ears? Not even close. In clinic, I've seen things that would make you cancel your next Q-tip purchase immediately. And no, I'm not exaggerating. Today, I'm going to walk you through some of the weirdest things I've found in people's ears and what you can learn from them. My name is 𝗪𝗂𝗋𝗯. I'm a doctor of audiology, and I've helped hundreds of people in the Toronto area to achieve better hearing and resolve complex cases of hearing loss. And over the last 10 years, I've looked in thousands of ears and taken out loads and loads of wax. Let's start simple. We're talking impacted wax the size of a marble. Most people think earwax is dirt. It's protective. It helps trap bacteria and debris. When people use cotton swabs, they push the wax in deeper instead of removing it. Over time, it compacts. I've seen ear canals completely blocked. Not partially, completely. I mean, the person usually comes in saying, I woke up this morning and my ear feels plugged. Or better yet, my ear was feeling plugged after a shower and I grabbed a Q-tip and now I can't hear anything. And I already know what that means. It didn't build up overnight. This was months in the making. The lesson here, stop putting things in your ears. Insects. Yes, alive ones, and of course, dead ones. This usually happens while you're sleeping or camping. Person usually comes in with a bit of discomfort, hearing a buzzing sound, bit of scratching or crackling in the ear. And let me tell you, when something is moving pretty close or on your eardrum, you're going to know it. It's uncomfortable, sometimes painful, but it's totally treatable. The key is not to panic and start blindly digging around in your own ears. Forgotten objects. Now, I mean, sometimes we'll find these in kids' ears, but adults aren't immune to it. And of course, I've seen pieces of cotton swabs. It's very clear. You look in the ear and you see a lot of white, fluffy cotton in there. Hearing aid domes. This happens. Often people call the clinic frantic because they can't find their dome and they think it's in their ear, or they know it's in their ear because it's really uncomfortable. And it happens. I would say with hundreds of patients, we're taking out maybe less than 10 domes a year. So it doesn't happen frequently, but it happens. Earbud tips and small beads. My favorite to date, contact lenses. I had somebody come in once and they just felt like their ear was blocked or plugged. And they just couldn't understand why. They had been to the family doctor a couple of times. There was no wax. They were waiting on an ENT referral, but that was 6 months down the line and they were just so uncomfortable. And it was contact lenses. This person would keep their sleeping earplugs on their bedside table next to their contact lenses. And when they were half asleep, they would take out their earplugs, put it on their nightstand, resting them in their contacts. And of course, at night in the dark before they'd go to bed, again, half asleep, they'd put their earplug in their ear, not realizing there was a contact lens on it. Eventually, when the patient came back from ENT, they had 7 contact lenses in their ear canal. They said as soon as they were pulled out, the relief that they felt, their ears were no longer scratchy or itchy, and they just felt normal again. If your hearing suddenly drops or feels blocked, especially on one side, this is not something to ignore. This is something to have checked out immediately. Infections that should have been treated sooner. This is when the abnormal looking ear starts to become concerning. Untreated outer ear infections can lead to swelling, debris buildup, discomfort, discharge, and a strong odor. Many people will wait. Many people think or hope it's just going to go away on its own. If your ear is painful or draining fluid or has a stronger, unusual odor to it, that's not normal earwax. That needs attention. And the cotton swab damage that nobody talks about. Here's the irony. The thing that people use to clean their ears is usually the biggest cause of the problem. I've seen scratched ear canals. I've seen pushed in earwax. I've seen broken cotton swabs. And worse yet, I've seen perforated eardrums from a cotton swab pushed too deep. Your ear canals are delicate. They don't need scrubbing. They're self-cleaning. If you feel blocked, that's what professionals are for. Here's the takeaway. Your ears are not supposed to be spotless. Having some wax is normal and it's actually healthy. Most of the kind of unsavory things we see in ears usually come from two causes: ignoring symptoms and putting objects where they don't belong. If you're using cotton swabs regularly, consider this your sign to stop. This video made you slightly uncomfortable. You'll remember it. So make sure you like this video, subscribe to our channel, and honestly, share this video with someone who still thinks using cotton swabs are harmless. Because when it comes to your hearing, a little bit of prevention goes a long way. That's how we cut the noise.